Good morning, and thank you for being here. It is my pleasure to share my Capstone project with you today. The project will analyze how mobile health applications implement medication compliance improvements for a highly vulnerable population, such as adult day healthcare participants. In my project, I specifically studied the use of two applications, Round Health and My Meds. Both apps really promote medication management through personalized reminders, tracking features, and alerts to caregivers. As I am sure most of you can attest, medication non-compliance is among the most persistent and costly challenges in the realm of chronic disease. It is further complicated among the elderly by barriers such as polypharmacy, cognitive decline, and poor digital literacy. The project is grounded in nursing informatics and evidence-based practice using data, technology, and clinical expertise directed toward health problems in the real world. Now in this presentation, I will be taking you through the background and rationale of the study, the literature review, methodology, and findings, and lastly, recommendations for the future. So let's begin by discussing why medication compliance is such a critical issue in the adult day healthcare setting and how mobile health technology may offer a promising solution. One of the biggest problems in healthcare right now is people not taking the medication as prescribed. This is especially true for older people who have a lot of chronic conditions and complicated drug schedules. In fact, almost half of people with chronic disease don't take their medicine as directed. This makes it harder to control the disease, causes more hospital stays, and raises the cost of healthcare. The goal of my Capstone project was to look into these problems by testing two mobile health apps, Round Health and My Meds. The purpose of this app is to help patients keep track of their drug schedules by providing real-time reminders, visual progress tracking, and the ability to let caregivers know when doses are missed. So by using the Plan, Do, Study, Act or PDSA cycle as a framework, I implemented and tested this application with adult day healthcare participants. This iterative approach allows for continual refinement based on feedback from users and stakeholders. We measure improvements in medication adherence through a combination of pre and post-intervention surveys, app-generated adherence data, and semi-structured interviews with participants and caregivers. Beyond the clinical data, this project illuminated the power of technology to enhance patient self-management, especially when paired with caregiver support and nursing guidance. It also highlighted the importance of interdisciplinary collaboration, bringing together nurses, pharmacists, IT specialists, and social workers to support digital adoption among older adults. Overall, this work demonstrates how mobile health tools, when implemented thoughtfully and inclusively, can play a pivotal role in addressing long-standing challenges in chronic disease care. Adult day healthcare participants are especially high-risk group for medication non-compliances. Many of these people have many chronic conditions, what we call it multimorbidity, and are on complex prescription regimens, a scenario known as polypharmacy. This combination puts patients at high risk for medication mistakes, drug interactions, and negative health consequences. According to Brown and Bonsall, approximately half of all persons with chronic disease do not take their medication as prescribed. This figure could be considerably higher in the ADAC group due to added obstacles such as cognitive decline, low health literacy, and inconsistent caregiver support. Non-complying in this population frequently leads to preventable hospitalizations, more emergency room visits, and lower overall quality of life. This is where mobile health applications can have a significant influence. These digital technologies are scalable, cost-effective, and easily accessible, making them perfect for community-based care settings such as adult day healthcare programs. Apps such as Round Health and My Meds assist overcome essentially care coordination gaps by providing individualized reminders, medication trackings, and even caregiver notifications. Importantly, mobile health technology can benefit people who are often underserved by traditional healthcare systems, such as those who live in rural areas or have restricted transportation or mobility. These apps empower people to take a more active role in their healthcare management by improving access to health education, reinforcing daily routines, and boosting caregiver involvement. Nursing informatics bridges clinical practice with technology. It enables the design of technological robust, patient-centered, user-friendly, and real-world healthcare solutions. In this study, mobile health applications in adult day healthcare programs demonstrate how informatics empower nurses to lead digital health innovation. These tools are strategically solutions that help nurses solve long-standing difficulties like medication non-compliances, fragmented communication, and care coordination. To promote high-quality personalized care, we empower nurses to implement and assess technologies like Round Health and My Meds. Value-based care prioritizes outcomes, patient satisfaction, and cost efficiency that this fits perfectly. Nurse informatics ensures that treatments are evidence-based, data-driven, and tailored to eliminate inequities, especially among underprivileged populations that are typically digitally excluded. The initiative shows how nursing informatics may improve chronic disease management by boosting compliance and the care experience by training frontline staff and evaluating app usage statistics. Nursing informatics promotes continual improvement and sustainability. On the whole, it emphasizes nurses' positions as innovators, educators, and leaders in modern health care. One of my main goals as a nurse informaticist with this Capstone project was to improve my capacity to assess, implement, and support digital health solutions, especially mobile health applications that help patients get better care and get more involved in their care. This encounter gave me a chance to see how mobile health solutions like Round Health and My Meds are used in the real world. I learned how to use both quantitative and qualitative methods to evaluate their usability, get useful input from users and caregivers, and analyze their impact. This project made me think critically about how to integrate technology, not just from a technical point of view, but also from the point of view of patient safety, user experience, and system alignment. Working with an interdisciplinary team that includes nurses, pharmacists, IT specialists, and social workers was just as valuable. These partnerships made it clear that for healthcare to successfully integrate new technologies, it needs more than just new ideas. It also needs a common vision, good communication, and strong clinical leadership. As nurse informaticists, we are in a unique position to function as translators between clinical and technical teams, ensuring that technology helps patients, not the other way around. I hope to use the skills I have learned from this research in future jobs in clinical informatics, health information systems, or perhaps health IT policy. I really wanted to assist organizations put in place scalable digital interventions that fill gaps in care, promote health equity, and get healthcare systems ready for the future. In all honesty, this Capstone project has shown me that informatics is more than just a tool. It is a way to change how we provide and manage care. This capstone studies adds to the increasing body of research on mobile health and how it influences medication compliances, especially in older adults with chronic conditions, looking at how well applications like Round Health and MyMeds perform help us discover how digital interventions might employ in community care. Quantitative surveys and qualitative interviews review how patients and caregivers utilize these tools, which aspects are most effective, and where more work is needed. These findings impact clinical practice, system-level healthcare policy, and planning. The campaign emphasizes the need for sponsored digital literacy initiatives, especially for older adults who may be new to technology, giving this group the skills and confidence to use mHealth tools can improve the health and reduces care inequalities. Policymakers and administrators can also learn from the data how crucial incentives are to connect mHealth platforms to EHRs. It will also promote interoperability, real-time monitoring, and continuity of care across settings, making treatment coordination easier. This project was grounded in three key objectives that together provided a comprehensive framework for evaluating the real-world effectiveness of mobile health tools in adult day healthcare settings. First, I set out to quantify changes in medication compliances by using pre- and post-intervention surveys. These surveys help capture self-reported compliance behaviors before and after participants began using the apps. The goal was to determine whether tools like Round Health and MyMeds had a measurable impact on the consistency and reliability with which individuals took the medications. By comparing pre and post data, I was able to track trends in compliances and assess the intervention's short-term outcomes. Second, I aim to understand the user experience by conducting semi-structured interviews with both ADAC participants and their caregivers. This conversation provided rich qualitative data about how users interacted with the apps, what features they found the most useful, and where frustrations or usability challenges emerged. Capturing these live experiences was essential, not only to evaluate satisfaction, but also to ensure that the technology was meeting users where they were, both cognitively and emotionally. Third, the project sought to identify potential barriers to long-term implementations and engagement. Common challenges such as limited digital literacy, accessibility concerns, and privacy or data security apprehensions were closely examined. These barriers are particularly relevant when working with older adults and underserved populations, where technology adoption can be inconsistent or even resisted. By combining quantitative metrics with qualitative feedback and implementation insights, this project delivered a well-rounded, evidence-based evaluation of these mobile health apps. This approach ensured that both clinical impact and user experiences were taken into account. Critical elements will determine whether an intervention is scalable, sustainable, and suitable for broader healthcare integration. Mobile health apps improve drug compliances, particularly in chronically ill patients with complex prescription schedules, according to the studies. Tran et al. Discovered that personalized medication reminders alone improve compliances by 30%. For the elderly, timely plan instructions that fit their daily routines are quite beneficial. Patients who receive personalized reminders are more likely to stick to their treatment plans and avoid missing medications. The research also underlines the need of caregiver integration features, such as portals that allow family members or support staff to get notifications and track compliances. These elements facilitate communications and responsibility among patients, caregivers, and the care teams. According to study, caregivers assisted patients stick to their regimen and report higher levels of satisfaction with their care. Other research has found that user-centered design, which emphasizes simplicity, clarity, and ease of navigation, is critical for long-term health app engagement, particularly among older people with limited computer literacy. These findings assisted us in selecting a project app. We chose Roundhealth and MyMed because they provide adjustable reminders, visual medication tracking, and caregiver alerting that are research-backed and relevant to our target market. The literature backed up the theoretical basis and practical design of this intervention. It confirmed that our method was consistent with current research and adaptable to community-based care settings such as adult day healthcare like ours. Even though mobile health apps have a lot of documented benefits, there are some key challenges that can limit how useful they are, particularly when it comes to older adults in community-based care settings like adult day healthcare. Usability is a big deal. Foster et al. Pointed out that older adults often find app interfaces a bit complicated, which can result in feelings of frustration, disengagement, or even giving up on a tool altogether. Some older adults might not even be familiar with design conventions, gestures, or icons. A user-friendly and smooth app design is not just a bonus, it's crucial for getting people on board. One big problem is the lack of EHR integration. In mobile health apps and healthcare systems don't share data smoothly, doctors cannot really evaluate how well patients are sticking to their plans or staying active. This fragmentation really makes it tough for the software to be effective for real-time interventions and keeping up with continuity of care. If a provider cannot get to the compliance data during a patient visit, they might miss out on seeing how well the treatment is working or if the patient is following the plan. In our project, we intentionally addressed these challenges on 2 occasions. We started by tailoring the training for ADAC participants, a lot of whom have limited computer skills or physical disabilities. The use of straightforward terms, practical experience, and helpful paper guidelines made it easier to understand the app and feel comfortable during these sessions. Next, we reach out to caregivers, nurses, and IT workers to give their thoughts. The feedback really helped us enhance the app's introduction, assistance, and monitoring feature. This partnership also improved sustainability and satisfaction by expeditiously resolving technical and usability difficulties. Early detection and resolution of these issues enabled the project to promote deployment of mobile health solutions as well as significant and continuous interactions with them. Behavior science is very crucial for making and using mobile health technology when it comes to modified daily routines like taking medications. Gamification, it's all about adding games-like features to locations that are not games to get people interested and driven. In the field of behavioral science, it's a major deal. Trend says that features like success badges, tracking progresses, daily streaks, and awards might help keep people interested in health apps for a long time. These little rewards help people stay motivated and keep up their behavior. It's important to remind older people who have been following strict regimens for months or even years. It can make a great difference. The future of success of mobile health technologies will depend on how effectively they are built, how well they work in clinical settings, and the regulations and infrastructure that make them easy for everyone to use. People from all kinds of communities need to be able to use these technologies fairly. Mobile health applications can help people remember to take the medication as directed and keep track of their treatment better. However, many older people, especially those who live in rural or low-income regions, still have problems utilizing them because they are expensive. They don't have internet access or don't know how to use technology. These groups are most likely to gain from new technology, but they are also most likely to be left behind as the healthcare system becomes more digital. Nguyen and Carter believe that these disparities need to be closed by changing policies. For instance, allow Medicare and Medicaid to cover up ad subscriptions, training in digital literacy, and remote monitoring. Digital technologies are needed for health equity when they are part of the care continuum. Policy should also make it easier for mHealth data to be added to EHRs and for diverse systems to work together. The study involved 8 participants who struggled with chronic illnesses, including hypertension, diabetes, heart failure, and arthritis. Patients with complex care requirements who are at higher risk of failing to adhere to their medication regimens are the primary focus of adult-day healthcare programs. This is frequently the result of factors such as the presence of cognitive decline, the use of multiple medications, and dealing with physical challenges. Despite the relatively small size, this study provides us with valuable, in-depth insights into the actual use of mobile health tools and the impact on this vulnerable group. The feedback provided by each participant was extremely beneficial in identifying the strengths of the app and the areas in which could be improved from the user's perspective, particularly in the areas of personalized reminders, navigating the app, and increasing the clarity of notifications. Registered nurses, pharmacists, social workers, and health IT specialists, in addition to end consumers, were all involved in the initiative. Everyone had their own perspective on the assessment. Nurses talked about clinical workflows and how to educate patients. Pharmacists took a look at the apps to check for drug information and safety alerts. IT experts took a look at the apps to check out their security, functionality, and interface. Social workers plays a key role in figuring out what patients need, getting caregivers involved, and spotting any gaps in access. This approach brought together different fields and really anchored the project in frontline care delivery, making it even stronger. We made sure that our proposals were practical, especially in situations where resources are limited. We included both quantitative and qualitative data in our review to show how participants use mobile health apps. The numbers seem quite positive. 85% of users said the applications were easy to use, which is important when dealing with an older person who might not be as tech savvy. Even better, 90% of the people who took part reported that the built-in reminders helped them stick to their medications. This means that offering simple, frequent instructions can affect how people act. These data truly came to life with qualitative input. Several people appear to agree, and one comment really hit the nail on the head. I really appreciate those little nudges, but I love to be able to change the timing a little. This quote really packs a punch. Digital health evaluations typically overlook caregivers. They are family, friends, support workers who help older adults with chronic disease every day. Caregivers' perspective help this investigation understand how mobile health apps affect primary users and the support networks. The app's real-time tracking and alerts impressed the caregivers. Lots of folks felt relaxed knowing that they could remotely monitor their loved one's prescription intake. A caregiver felt confidently they could act swiftly if a dosage was missing. Openness can change everything for families balancing employment, caregiving, and other obligations. Though not all comments were positive, they were helpful. Caregivers were frustrated by delay alarms, sensor issues, and app user interface flaws. Another strategy to cut down on turnover due to exhaustion or confusion is to provide regular refresher training in addition to continuing technical assistance. Engagement is not only about getting people to get on board at first, it's also about keeping the interest, confidence, and ease of use over time. In short, the study did produce useful results, but by being aware of these limits, we can better prepare future mobile health solutions that can be scaled up and used in a variety of situations and populations. Feedback from participants and analysis of the project led to several suggestions for how to make this intervention bigger and keep it going. Older people may have trouble speaking or thinking clearly, so we should first meet their needs. Several people asked for voice alerts. A simple audio reminder might make things a lot easier to use and help people who have trouble with small fonts or complicated interfaces not miss their doses. Making the tone and the frequency of these voices cues more personal might make them easier for blind individuals to use. Second, a lot of older people and their caretakers don't know how to use technology well. To solve this, work with community centers, libraries, or groups from older people to hold basic training sessions. There are ways to make it hands-on, peer-led, and appropriate for how older people or adults learn. Giving users confidence and knowledge in how to utilize health applications is just as important as how well these apps work. Continuous technical support and refresher training will also help keep people interested. In closing, this project clearly demonstrates that mobile health applications, when thoughtfully designed to address the unique needs and preferences of users, have a powerful impact on improving medication compliance. This digital tools empowers patients by providing timely reminders, personalized support, and greater control over their own health management, which ultimately contributes to better clinical outcomes and quality of life. As nurse informaticists, we play a critical role in advocating for and integrating these innovative technologies into healthcare practice. Our expertise allows us to bridge the gap between clinical care and digital solutions, ensuring that these tools are accessible, user-friendly, and tailored to meet the diverse needs of all patient populations, particularly those who may face barriers due to age, literacy, or socioeconomic factors. By championing mobile health apps and similar advancement, we support the delivery of equitable, patient-centered care that not only addresses medication compliances, but also fosters engagement, education, and self-management. This aligns with our broader mission to improve health outcomes through the thoughtful application of technology and data-driven insights. Thank you so much, and this concludes the end of my oral presentations. This is the end of the slideshow. Thank you, and I would love to hear your thoughts or questions about the apps, the methods, or how this might work in your settings. Thank you.